Hello, you're welcome to my platform. I am Dr. Sandra and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. I am so excited to introduce to you my newly launched electrical appliance online store. It has high quality refrigerators, it has washing machines, microwaves, air fryers. It has ranges too. You can basically be cooking on top and you're baking something on the bottom. It also has these 5-in-1 food processors. Please support the work that I am doing on this platform by purchasing any of these items. Please place your order today by reaching out to me via WhatsApp or via a call on my numbers on the screen, and then your order will be delivered to you. Deliveries can be done to all parts of Uganda, but in the future, as the business grows, I'll be able to ship to those outside of Uganda.
Please place your order now.
I am back to continue the conversation from where we left off by talking about the fourth healthcare associated infection, and that is the Clostridioides difficile infection. Clostridioides difficile infection, by the way, is a condition that is characterized by diarrhea and colitis, that is inflammation, irritation of the large intestine, the colon. Clostridioides difficile infection is very common in individuals that have used antibiotics, and it is caused by a bacterium called Clostridioides difficile. Clostridioides difficile is a bacterium and it resides in the large gut, the large intestine of your gastrointestinal tract, the system of your body. Actually, it is a tube that is responsible for breaking down your food, absorbing nutrients, and eliminating the wastes from the food that you've eaten. The Clostridioides difficile resides in your large intestine as part of the normal flora. Normal flora, by the way, are groups of good bacteria, and they reside inside and outside of our bodies. For example, on the skin, in the mouth, and the gastrointestinal tract. That is the system within your body. It is like a tube that is responsible for breaking down food, absorbing the nutrients, and eliminating the wastes that remain after the food has been broken down. So this waste is eliminated from the body in form of feces. The gastrointestinal tract is simply your intestines. Just look at the normal flora as the good bacteria that reside in these intestines. For the Clostridioides difficile, it specifically resides in the large intestines. The normal flora are good bacteria because they can reside within the human being or on the surface, for example, on the skin of the human being, without causing any harm. For example, they can benefit from the human being and also bring benefits to the human being. For example, they can produce some nutrients for the human being. Some of the normal flora can just benefit from the human being without causing any harm. That is why we call the normal flora the good bacteria. Some of the bacteria that form part of the normal flora can just prevent other bacteria that form part of the normal flora from overgrowing or multiplying in large numbers. So their presence kind of keeps the other bacteria that form part of the normal flora in check, such that they don't overgrow, because once some of the normal flora overgrow or multiply in large numbers, they cause disease. So some of these normal flora prevent these other normal flora or the bacteria that form part of the normal flora from multiplying in large numbers, so that they don't cause disease. However, in a setting where an individual has used antibiotics, that is the medications that kill bacteria, some of the bacteria that form the normal flora will be killed off. Once some of the bacteria that form the normal flora have been killed off by the antibiotics, the remaining bacteria that form the normal flora will continue to multiply in large numbers. Because remember, I told you that some of the bacteria that form the normal flora are responsible for keeping other bacteria that form the normal flora in check, such that they don't multiply in large numbers. That is what exactly happens in the Clostridioides difficile infection. The Clostridioides difficile will continue to multiply, to grow in large numbers, because the bacteria that form part of the normal flora that was responsible for keeping it in check so that it does not overgrow in large numbers have been killed off by the antibiotics. As the Clostridioides difficile continues to overgrow in large numbers, it will produce some toxins, some poison called toxin A and toxin B. Toxin A causes a deactivation of certain groups of proteins called the Rho family proteins. The Rho family protein is responsible for keeping the cells that form the inner lining of the intestines close to one another. So when it is deactivated, that means these cells will not be close to one another. They are going to draw apart. So this means that water will escape from the rest of the intestine, the different layers of the intestine, into the lumen of the intestine, and so the patient will get diarrhea, watery stools. The toxin B will cause a disruption in certain groups of proteins called the actin cytoskeleton. The actin cytoskeleton is found inside the cells. The actin cytoskeleton is responsible for maintaining the integrity, structure, and shape of the cells. So if it is disrupted, that means the shape, the integrity, and structure of the cells will also be compromised. Once the structure, shape, and integrity of the cell has been compromised, the cell will sense that it has been damaged, and so it will initiate a process called apoptosis, that is programmed cell death. The cell will die. Once the cells that line the inside of the large intestine have died, water will escape from the different layers of the large intestine into the lumen of the large intestine, and so the patient will pass out watery stools. They'll have diarrhea. The Clostridioides difficile will also be passed out together with the watery stools. And this commonly occurs in a healthcare setting, for example, a hospital or a nursing home. Once outside the body, the Clostridioides difficile will be transformed into a more resistant form called a spore. The spore of the Clostridioides difficile is literally the bacterium covered in a shell. This helps it from being destroyed by the harsh environment outside the body, and it also helps it from being destroyed by antibiotics. This allows the spores to stay longer in the environment without dying, and this way they can easily be ingested or they can easily be eaten by another individual, and so they can reinfect another individual. These spores can be found on different surfaces, for example, the floor of the ward, the walls of the ward, the door handles and medical equipment. Another individual can be infected by these spores by touching these contaminated surfaces and then touching their mouth. So the spores can be accidentally ingested if the individual touches their mouth after touching these surfaces and they never washed their hands. The spores can as well be transmitted from one individual to another through a handshake. For example, individual A might have touched the walls or the door handle of the ward that were contaminated with the spores of the Clostridioides difficile, and then they don't wash their hands and then go ahead and have a handshake with individual B. This can result into transmission of the spores from the hand of individual A to the hand of individual B. And then if individual B accidentally touches his or her mouth, they can accidentally ingest or eat the Clostridioides difficile spores. Transmission of the infection can also occur if an individual got into contact with the feces of the infected individual. Once ingested, the spores of the Clostridioides difficile will just pass through the stomach without being affected by the contents of the stomach, and then they'll enter into the small intestine. While in the small intestines, the spores will now be transformed into the active form of the Clostridioides difficile. They'll continue to multiply in large numbers. However, they will not cause damage to the small intestine. This is because while in the small intestines, the Clostridioides difficile will not produce the toxins, the poison, that is toxin A and toxin B. This is because the environment within the small intestine is not conducive for the production of these toxins, so there won't be any damage to the small intestines. There will only be overgrowth or multiplication of the Clostridioides difficile. However, when they reach the large intestines where the conditions are favorable for the production of toxin A and toxin B, they will cause the damage that I laid out earlier. Therefore, the affected individuals will pass out the watery stools that also contain the Clostridioides difficile, and the cycle will continue. Which individuals are at risk of getting the Clostridioides difficile infection? The first category of individuals that are at risk of getting the Clostridioides difficile infection are those that have a low immunity. For some reason, maybe they have HIV, they have diabetes mellitus, they are on steroids, or they are on anti-rejection drugs. Maybe they underwent an organ transplantation. Individuals that have comorbidities, other chronic conditions, for example, renal failure, that is kidney failure, diabetes mellitus, hypertension, the elderly, that is more than 65 years of age, individuals that have had prolonged antibiotic use, individuals that have had a prolonged hospital stay, a prolonged hospitalization, individuals that are exposed to environments where Clostridioides difficile is very common. For example, the healthcare settings like hospitals and nursing homes. Individuals that are on medications that suppress the secretion of gastric acid. For example, the proton pump inhibitors. For example, omeprazole. How do you know if you or your loved ones have the Clostridioides difficile infection? You might develop watery diarrhea, that is 3 or more episodes of diarrhea in 24 hours. There can also be loss of appetite, nausea, that is, you might feel like you want to vomit. There can also be abdominal pain, abdominal distension, that is, the abdomen will become bigger out of the blue. You might also develop fevers, that is an increase in the body temperature. Your body will become very hot. However, these signs and symptoms will always develop in individuals that have a robust or a good immunity. However, in individuals that have a low immunity or the elderly, the signs and symptoms are going to be different. For example, there can be altered mental status. For example, the individual might become confused or unconscious. There can also be general body weakness, tachycardia, that is an increase in the pulse rate, tachypnea, that is an increase in the respiratory rate, and hypotension, that is a decrease in the blood pressure. All these signs and symptoms commonly occur in a setting of recent antibiotic use, especially the broad-spectrum antibiotics. However, these signs and symptoms usually occur within 1 week or 2 weeks of using antibiotics. What are the complications of the Clostridioides difficile infection? The first complication is dehydration, that is, the water reserves of the body will be depleted. The second complication is colitis, that is, inflammation, irritation of the large intestines. And specifically, the colitis or the inflammation or irritation that is caused by the Clostridioides difficile is called pseudomembranous colitis. The third complication is toxic megacolon. Toxic megacolon is when the large intestine is swollen and it cannot move, so the stool becomes stagnant in the large intestine. So a patient that was passing out watery stools might at some point end up not passing stool when they get the toxic megacolon. The fourth complication is paralytic ileus, and this usually happens because the individuals usually lose electrolytes, for example potassium and calcium. These electrolytes are responsible for enabling the intestines to move. So the intestines will not move because these electrolytes have been lost in the diarrhea, the watery stools. The fifth complication is reactive arthritis. The individuals that get the Clostridioides difficile infection can also have inflammation, irritation of the joints, that is reactive arthritis. How do we come up with a diagnosis of Clostridioides difficile infection? The latest recommendations that we formulated in 2021 for the diagnosis of Clostridioides difficile infection suggest that we use a two-step strategy for the diagnosis of Clostridioides difficile infection for all patients that have unexplained diarrhea, that is 3 or more episodes of watery diarrhea or watery stools in 24 hours. The first step employs the glutamate dehydrogenase antigen test, or we can do a nucleic acid amplification test, for example a PCR. These two tests are very sensitive, meaning they can easily tell if there is an infection or if the patient has the Clostridioides difficile infection. This is because they detect the presence of the Clostridioides difficile, and therefore a negative test rules out a possibility that the patient has the Clostridioides difficile infection. If the glutamate dehydrogenase antigen test or the nucleic acid amplification test, for example the PCR, are positive, that is when we go ahead and do the toxin enzyme immunoassay, looking out for toxin A and toxin B. Patients that have positive results of the glutamate dehydrogenase antigen test or the nucleic acid amplification test, for example PCR, that are positive, and also positive results of the toxin enzyme immunoassay, these patients are confirmed to have active Clostridioides difficile infection, meaning the tests in step 1 and step 2 will have to be positive in order for the patient to be confirmed to have the active Clostridioides difficile infection. This means that these patients are colonized with the Clostridioides difficile, meaning in their large intestine there is overgrowth or multiplication of the Clostridioides difficile, but they are also producing toxins, so they have active disease, they have active Clostridioides difficile infection. However, in patients that have a positive glutamate dehydrogenase antigen test or the nucleic acid amplification test, for example PCR, but they have a negative toxin enzyme immunoassay, that means that these individuals, yes, they have colonization, like they have multiplication of the Clostridioides difficile infection. However, because the toxin enzyme immunoassay is negative, the Clostridioides difficile is not producing the toxin, so they don't have active disease. So here we have to rely on the clinical picture that the patient has. If they are very sick, we can put them on treatment. If they are not, then there is no need of treatment. So it all comes down to having good judgment of the patient's clinical condition at that moment. If the toxin enzyme immunoassay is negative, but the glutamate dehydrogenase antigen test or the nucleic acid amplification tests, for example PCR, are positive, meaning only the tests from step 1 are positive, but the test in step 2 is negative. What is the treatment for the Clostridioides difficile infection? The first thing we have to do is, if the patient is on antibiotics, the antibiotics that have caused the overgrowth of the Clostridioides difficile by killing off the rest of the normal flora, we have to stop that antibiotic immediately. For individuals that are just getting the first episode, we always employ vancomycin or fidaxomicin, and we usually use it for at least 10 days. However, if the individual is someone who is at risk of getting a recurrence of the Clostridioides difficile infection, for example, individuals that are elderly, that is more than 65 years of age, those that had a prior history of the Clostridioides difficile infection, those with history of antibiotic use, those on medications that suppress the secretion production of gastric acid, stomach acid, for example the proton pump inhibitors, for example omeprazole, rabeprazole, pantoprazole, those with chronic conditions, for example chronic kidney failure, a low immunity, individuals that have had a recent hospitalization, as well as the female gender. For those individuals, we use bezlotoxumab. We use bezlotoxumab if fidaxomicin is not available, but we shouldn't use vancomycin in those patients that have a risk of recurrences. If the patients get a first recurrence, we usually use fidaxomicin, especially if we use vancomycin in the first episode. However, if the patient was given fidaxomicin in the first episode, we should always give bezlotoxumab in these patients. For patients that get second recurrences or subsequent recurrences, we usually employ bezlotoxumab or a fecal microbiota transplant. By the way, a fecal microbiota transplant is a fecal preparation from a healthy individual. So we get fecal matter from a healthy individual, and then we can donate it and put it into the large intestine of the affected individual. The individual that has the Clostridioides difficile infection. It can help to introduce or restore the normal flora, the good bacteria that were killed by the antibiotics. Remember that some of the normal flora, the good bacteria within this stool preparation from the healthy individual will help to keep the Clostridioides difficile in check such that it does not overgrow. That way the patient can easily be healed from the Clostridioides difficile infection. How can we prevent the Clostridioides difficile infection? Please avoid unnecessary use of antibiotics. Antibiotics should only be used when necessary, only when you need them. Please exercise good hand hygiene by using soap and water, especially after using the toilet. By the way, hand sanitizers, for example, the alcohol-based hand rub, are not effective against the Clostridioides difficile. So for the prevention of the Clostridioides difficile infection, we only recommend soap and water. In healthcare settings, for example, hospitals and nursing homes, please make sure that you disinfect all the surfaces of these facilities. For example, the door handles, the door, the floor, the walls, and you should always use effective disinfectants. All patients that are suffering from the Clostridioides difficile infection should always be isolated from the rest of the patients. And please always use latrines and toilets if you want to defecate. Avoid defecating in the bush or in an environment which is not a toilet or a latrine. This is because this can enhance or it can promote the transmission of the Clostridioides difficile infection. That is what I had for you. Thank you so much for watching and listening. Please share, like, comment, and subscribe. Also hit the notification bell such that you can get notified whenever I upload a video. Please also support the work that I am doing on this platform by purchasing any of my items from my electrical appliance online store. Please place your order today by reaching out to me via WhatsApp or via a call on my numbers on the screen, and then your order will be delivered to you. Deliveries can be done to all parts of Uganda at a free cost. You don't have to pay for the delivery, but in the future I'll be able to ship to those outside of Uganda. Thank you so much, and I'll see you in my next video. Bye.